Hi everybody. Hope y'all had a great 4th long weekend. At least had a long weekend, I hope. I did. I had a 4th week out of town at the campground with my mom and other family members who were in the same campground. So we had a good time. Good old-fashioned 4th. Good old American 4th. It's one of my favorite holidays. I don't know what it is about the 4th of July, I guess. No, I'm a patriot, so, but just a lot of good memories around 4th of July for me. Anyway, this is just a quick post-doctor check-in. I saw my hepatologist today and pretty much just confirmed some things we had already talked about in the patient portal. He's a very quick and thorough communicator in the patient portal, but he wanted to see me again today just to talk in person and to do a little bit of physical exam and get some weight right now. And this was a puffy day for me, but overall on the budesonide I've only gained like 5 pounds, which he thought was very, very good. But anyway, as planned, we talked about me switching over to azothioprine, which is the immunosuppressant that most people with autoimmune hepatitis take eventually. We can't stay on the steroids forever, and nor do I want to stay on the steroids forever. Really don't want to be on an immunosuppressant. So, but, you know, it is what it is. And, you know, I've had a little bit of a slow response on steroid, and but now I'm mostly in the normal range on things, high normal. My alkaline phosphatase, like I said in the last video, is still above normal, but seeing that it started out at 410 and now is down to 160, which is about 30 some points from being 30 to 40 points from being high normal. I take that as a win. You know, of course, we want to see dramatic drops and things when you're on a steroid and other treatments, but sometimes it's a process, and sometimes it's, you know, trial and error to get yourself there. So the first thing they're going to start me on now is the azothioprine. I've got to wait for about a week for it to get in, because I've had him order it through my mail order pharmacy, trying to get everything switched over there that I know I'm going to be on long term. So I will start that as soon as it comes in, and then I'm supposed to let them know the day I start, and then a week later I'll go in for some blood work. I've already been tested for the major side effect that could happen with the azo, and that is low white blood count. But they actually have already done, I think it's a genetic marker, to see if I'm at risk for the dangerously low white counts. But even though they're going to keep a close watch on my blood counts as I start this anal liver enzymes, of course, just to be sure that my white counts don't drop for some unforeseen reason, and that I'm getting a response with the immunosuppressant. So that's pretty much where we're at. Getting ready to do this switch over, and then once I do start the azothioprine, I'm on 6 milligrams of budesonide right now, down from the starting dose of 9 milligrams. Been on the 6 milligrams for a while. But the day I start the azothioprine, he's told me to drop down to 3 milligram, which is just 1 pill of the budesonide. And then we'll go from there as the taper, depending on what my blood work shows. So that's pretty much it. Pretty much, like I said, confirming what we pretty much already talked about. But, you know, they have to see every few months just to do the vitals and the weight, and, you know, just be sure that we're on the same page, and that he said he doesn't like to start anybody on an immunosuppressant without telling them the risks and benefits. Of course, the benefit would be that hopefully that brings down my liver enzymes even more and prevents the fibrosis in my liver, and resolves what little teeny tiny bit on biopsy was there. I do have an increased risk of skin cancer with this azothioprine. He says it's usually really doesn't show up usually before you're on it 15 or 20 years. But he does suggest I get a baseline dermatology consult, which I have seen a dermatologist in the past. I have lots of moles on my body, and I have had some precancerous stuff. So he recommends me to get a baseline starting with the azothioprine as soon as I can, and then go for yearly checkups just to make sure everything stays normal and doesn't morph into something we don't want it to morph into. Also, this is what I did not know, I hadn't gone this deep on the azo side effects, was that it does put a person at increased risk for lymphoma. He said the average risk for lymphoma in the population overall is 1 in 10,000. When you start taking an immunosuppressant, that does increase your likelihood of being in the 1 in 5,000 category, which is a little scary to me, but he still says, well, that's still not a high risk, even though it puts you at sounds like a 50% greater risk of lymphoma. But, you know, when you start messing with your immune system, you know, it does, you know, part of what your immune system does is protect you against cancer, which is the biggest, scariest thing about this, other than the fact that I could get, you know, viruses or bacteria. I have to be very careful about my exposure during high infection rate times, such as the flu season and stuff like that. And I have to be, you know, just to be careful in general. And if I do get sick and I don't get over it in a few days, I need to see a doctor just to be sure that I'm going to recover, or if I've developed something on top of it. So anyway, that's about it. I will probably, once I start the medication, give a few updates to see if I have any of some people have nausea when they start this medication, but he doesn't think I will, because he says I started a low dose. He said just take it with food. Usually that, and most people, it passes after their body gets adjusted to it. You know, some people have more fatigue. And it'll be interesting to see how my energy levels are tapering off the budesonide and going over to azothioprine. You know, I told him, you know, he keeps asking me if I'm having any itching or any symptoms that would, that go along with the autoimmune hepatitis. I really don't. I tell him occasional fatigue. You know, if I have a really busy day, usually the next day I have to just take it easy. No debilitating, nothing that interferes with my daily life. Actually, my energy's been better lately than it's been in a long time, and I hope that continues. Well, I'm going to end it at that, and I hope you all have a good day, whether you're watching this now or in the future, and stay tuned for updates. Bye.